a lot of people know what goes on behind the scenes at doctors' offices and hospitals. Every time you have an encounter at one of these healthcare facilities, your disease or disorder is documented with a number. These numbers are very important as they are a part of your permanent health record. They help keep track of all of your diagnoses, which enables healthcare providers to give you the proper care, even when you don't see the same provider all the time. For example, your primary care physician may refer you to a specialist, and your ICD-9 code will let the other provider know what your health condition is and why you were referred to them. The ICD-9 2014 version of the coding manual states, the ICD-9 stands for the International Classification of Diseases, 9th revision. It is published and regulated by the World Health Organization, also known as WHO. ICD-9 codes are used by hospitals, doctors' offices, and health insurance companies to document diseases, disorders, and procedures performed on patients in the hospital. Once the doctor diagnoses the disease and it is converted into a number, if anyone needs to know anything about a patient's health status, they could refer to that number and the diagnosis terms connected to it, as the number never changes and should consistently remain the same on all records. There are multiple steps involved in locating these codes. The doctor documenting the disease is just the first step. A medical coder then uses the ICD-9 coding manual to look up the medical term in an alphabetic index. The index lists the number that is connected with the term. This number is then looked up in another index called the tabular list. Each ICD-9 code can have anywhere between 3 to 5 characters, with each character meaning something different. Looking in and referencing the ICD-9 book, you can see that something as simple as a 1 at the end of a code versus a 2 can mean the difference between right and left, or a 1, 2, 3, 4, 5, 6, 7, 8, or 9 can mean a completely different body part, and the tabular list gives all of these specifics. On October 1st, 2014, ICD-9 will change to ICD-10 with the implementation of the 10th revision of the International Classification of Diseases. Transitioning from ICD-9 to ICD-10, The Examination of Potential Barriers by Patrick Rivers, Jiming Frimpong, and Mary Rivers states that a smooth transition between each of these coding systems is very important. Not only does ICD-10 change the length of characters that a code can contain from 3 to 5 to 3 to 7, but the ICD-9 coding manual only contains 13,000 codes, where there will be 68,000 codes available in the ICD-10 manual. So, even though it may not look like it, there is a lot of work that goes on and continues long after a patient's healthcare encounter has ended.